Why?
I just want to press you on one further point.
Getting perspective on this region from this region. Places that many of us know, but few of us get to see. Observing countries on the move, still rooted in tradition. It all starts here, and that's why we're here, bringing you the world from our Middle Eastern hub.
Connect the world with Becky Anderson, tonight on CNN.
I'm Max Foster in London, and this is CNN.
Where are the ventilators? Where are the gowns? Where's the PPEs? Where are the masks? Where are they? Where are they if they're doing it? When we went to war, we didn't say, any company out there want to build a battleship? Who wants to build a battleship? That's not how you did it. President said it's a war. It is a war. Well, then act like it's a war.
That was New York Governor Andrew Cuomo begging the federal government for help and warning that the state's already strained hospitals could be flooded with more than 100,000 new patients soon. And hospitals across the country are reporting major shortages still of those critical medical supplies and protective gear. Joining us now is Dr. Rochelle Walensky. She's the chief of infectious diseases at Massachusetts General Hospital and professor of medicine at Harvard Medical School. Doctor, thank you very much. I know it's a busy time for you. So this isn't just New York, obviously. What's happening at Mass General? Are you still having all sorts? Well, it's hard for us to know, basically, if hospitals are getting supplies or not, because one word comes out of the federal government, another comes out of governors' press conferences. So what's the situation in your hospital?
Certainly. Thanks for having me. We are probably a week or two behind New York, but we are scrambling. Right now we have the supply that we need, but we know what the weeks are, that what they look like ahead, and we are thinking a lot about our ventilator supply, how we could repurpose devices that we already have, how we might put 2 patients on a vent if we needed to, and how we could secure more ventilators from other sources. So we have what we need right now, but our units are getting fuller. Our ventilators are getting used. We've expanded our intensive care capacity, and so we believe we're probably in for what New York is seeing right now.
You say put 2 patients on a ventilator. Is that a practice that's been done before? Is that something you would recommend? Is that something that's advisable?
I would say that's a dire outcome of where we are. I have never seen it done until the discussion of it. I didn't know it was possible, but my colleagues tell me it is, and that if need be, we will do it.
The national stockpile of ventilators, has that been cleared out? What's your understanding? We just put up a graphic a second ago showing how many ventilators are in use and how many were, at least days ago, in the national stockpile. Have those now been loosened up and dispersed to hospitals around the country?
I can't speak to that nationally. I know that we're in a lot of discussions to try and secure more, and I know that pipeline, we could use a little more leeway into that pipeline, but I know those discussions are ongoing.
But just so that I understand, sorry, John, but just so I understand, when you say discussions are ongoing, meaning what? You're calling FEMA and it's saying, please give us more, and they're saying, we have more for you? I mean, what's the holdup?
Yeah, I don't know exactly where things are stuck. I think it would certainly, we need coordination at this at the federal level. We then need coordination at the state level. It doesn't help for us to have ICU beds and somebody else to have the vents. So I think all this coordination has to be done both federally, at the state level, and locally. And then we need the healthcare workers to be able to use the vents. We need respiratory therapists. So I think that coordination has to come from the top down, and yeah.
So, Doctor, and I think this is important because there's a lot of focus on New York City right now, but what are you seeing in terms of numbers of cases and the rate of change?
Yeah, first of all, we've been in touch with our colleagues in New York. Our hearts go out to our colleagues in New York. Our numbers are also doubling every 2 or 3 days. We're lower on the curve than New York is. We believe we'll be where New York is in about a week or 2. We're taking lessons from what they've done and certainly sending our love and support.
So on that line, though, if you're doubling every 3 days like New York is, do you think Boston will be ready to open for church services on Easter?
Right. you know, nobody wants to not have control over their lives, and everybody is very interested in understanding when things will end. Our modelers suggest that in Boston, we will probably be in the thick of it in the middle to late of April. I don't think we will be ready to be in a place where we are recongregating at around that time. I think if we are in the thick of it, it will be very clear we're not going to be able to recongregate at that time. I think if we thought so, we wouldn't have sent all of our kids home from college. And I just want to reiterate that we've been saying that your death rate is higher if you have comorbid conditions, if you're older. But when you have a vast number of people who are getting sick in the 20 to 45, 50 range, there is a mortality rate there in the 0.5 to 1%. And if that's the case, we are seeing lots of young people get very sick in our intensive care units. So when we are asking you to stay home, we are saying, please stay home, because we don't know who they will be. We have no way to predict who of the younger will get sicker and who will not. So please stay home, as if it could hit very close to home.
Doctor, that is so frightening. I feel like this morning we're hearing more about young people getting sick in New York. Half the cases are young people under the age of 44. This is different than what we were hearing out of China. This is different than what we had gotten our minds around, that, okay, if you're 70 or older, if you're infirm, you should stay home. Half the cases are under 44. It's time to adjust our thinking, I mean, is what I hear you saying from what you're seeing in your hospital, too.
Yeah, I think the real issue is that this disease is now rampant. If we expect before it dies down that 40% of Americans will have had it, or 40% of people in our own cities will have had it, that's a lot of young people. So even if you have relatively low mortality rates, or comparatively low mortality rates compared to the older or more vulnerable patients, you still have a lot of young people succumbing to this disease in a very scary way.
And if the president keeps comparing it to the common flu, which he is doing once again, how apt of a comparison is it?
You know, two things are different about the flu. One is there's a vaccine, and about half of Americans get vaccinated every year to protect themselves. The second is it's about half as contagious as coronavirus. So you put those two things together and you have a much more contagious disease that can hit a lot more vulnerable people.
We hear your warning. I mean, we hear you sounding it. Everybody needs to pay attention this morning. It feels, every day feels different, but today, with all of these new numbers, definitely feels more nerve-wracking for people. Dr. Rochelle Walensky, thank you very much. We know how busy you are, and we really appreciate you getting us all this information.
Thank you for having me.
John.
So President Trump is saying that full churches on Easter, he says it would be a beautiful thing, but it's the exact type of behavior that public health officials, governors, and mayors say could cost lives. What is the president hearing from allies, from Republican senators on this subject? That's next.
No matter where you are in the world, there is a clear pattern on how governments and leaders use the power in their hands.
Will this change Europe?
Demonstrations erupted over unemployment. There could be some very serious national security questions.
What about Mr. Trump's America?
Martin Luther King Jr. would be very disappointed.
Living and working in the U.S. right now gives me an important perspective as an outsider looking in.
How divided is America?
Quite divided.
Do you blame the president for that?
No.
You've cut off any friends or family who are Republican.
Yes. Politicians are hoping to turn all of this energy into votes.
How do you balance your politics and the need to make a statement?
Why do you think it's important to do what you did today?
I'm Robin Kerno in Atlanta, and this is CNN.
Sunday, the Prime Minister of Singapore joins Fareed. How is his country weathering the coronavirus pandemic? And what lessons can the U.S. learn? An exclusive interview on Fareed Zakaria GPS, Sunday.
This is the 100 Club, our look at companies that are 100 years old or older.
When I talk to anybody and tell them I work at Crayola, they always have a story to share about their first box, their first 64-count box, or the 24-count box that they use for school.
Crayola, the name synonymous with crayons, actually began 116 years ago under a different name, Binney and Smith, the company's founders. In 1903, the Crayola brand was born with the first box of crayons in 8 colors.
We were selling Crayola chalk in schools, and we noticed that the kids didn't have any colored wax sticks to color with. And so our founders, Binney and Smith, wanted to create a wax crayon that would be affordable for kids to use in the classroom.
Look, this is America. We gotta remember what matters. Friends, I'm Chris Cuomo. People come on here, they get tested, you get the benefit of it. How do you see where we are right now? Why not just own it? Tell the truth. You did ask Ukraine to look into Joe Biden. Of course I did. You just said you didn't. How can you beat President Trump? No tax on the middle class for any of them. This is not right versus left. This is about common sense. I understand your argument. I just hope you can live with it.
Cuomo Prime Time, Tuesday through Saturday on CNN.
Coronavirus.
It's facts, not fear. And we want to bring you.
Join Anderson Cooper and Dr. Sanjay Gupta for a live global town hall.
What this outbreak won't stop is our continued reporting.
Coronavirus, facts and fears. Friday on CNN.
Welcome to The Lead. I'm Jake Tapper.
The straight talk you need.
That seems to be completely contradicting.
From your man in Washington.
We're getting a new look at the headwinds that congressional Republicans already are facing.
The Lead with Jake Tapper. Tuesday through Saturday on CNN.
This is CNN.
We just got some breaking news from Buckingham Palace, and that is that Prince Charles has tested positive for coronavirus. He is 71 years old. Obviously, this is concerning on many levels. We don't know his condition. We don't know if he requires hospitalization. We don't even know if he has symptoms, John. But we will follow this. This is just the breaking news literally moments ago out of Buckingham Palace, and we will bring people an update as soon as we have it.
Obviously, this is developing and developing quickly. As you say, we don't have any details as to his current condition, but we do know that the United Kingdom later than other European nations on putting certain restrictions in, putting in those stay-at-home orders. We'd been told the Queen had moved away from people several days ago. I had not yet heard how the Prince of Wales was behaving or how he was living, but again, this is interesting information, and we'll get you these developments as soon as we can. In the meantime, the President of the United States is telling the country that he would love to ease social restrictions by Easter, despite a soaring death toll in tens of thousands of cases. This timeline is setting up a clash with governors and health officials. Joining us now, CNN political analyst Maggie Haberman and David Gregory. Maggie is a White House correspondent for the New York Times. Maggie, we're digesting the Prince Charles news. Forgive me, this is just coming in as we speak. But as we process that, explain to me the anatomy of how the president got to this Easter date and what he's hearing now from leaders around the country, because the governors we're talking to are saying this is a bad idea. Governor Larry Hogan of Maryland told me yesterday he's confused by this message. We know the public health officials think it's a confusing idea, and some Republicans, including Liz Cheney, are indicating they think it's a bad idea.
Right, John, it's actually easier to talk about the number of people who think this is not worth doing than the process by which the president arrived at this. There were a number of White House officials and people close to the president who, heading into the weekend, were already having a conversation about the fact that they might need to change these social distancing guidelines after the initial 15-day period had ended. They were looking at the devastation on the economy. They are predicting the unemployment numbers are going to be staggering. There are obviously many people who have been laid off and businesses that have closed. And they wanted to start putting this at the forefront of the president's mind. This kicked into overdrive with the president on Sunday night. He tweeted, as we've discussed and as we've been talking about all week, that the cure should not be worse than the disease. But this Easter deadline basically came to the president on his own, he said. What it does do is it builds in a couple of additional weeks where if the virus starts to get worse, if the curves in states start to get worse, the president can modulate. He can change the date. He can push it back. Unfortunately, it cuts against the message that a lot of governors are sending, particularly in New York State, where there is a huge number of cases, And I think that the more there are conflicting messages coming, not just from the president versus governors, but the entirety of the federal government, it's hard to see how that helps the economy, hard to see how that helps the financial markets. And I think that's the dynamic the president has created with this sort of whipsaw of messages in the last 2 weeks.
David, as I was listening to the president's press conference yesterday at the White House, I was taking notes, as always, and the first 2 words that I wrote down on my paper, I feel like Smirconish right now, were magical thinking. Magical thinking. When Caitlin Collins asked the president, where did you come up with your Easter date? He had said that it would be a beautiful time for people to be able to come back out and for churches to be full. And she asked him, where did you come up with that date? And he just said that he thought it would feel good. It would be a beautiful time. And he also said, quote, we're near the end of our historic battle. That's just wishful thinking.
Yeah, there's no question about it. And to me, what strikes me as the obvious danger is that you have a lot of people around the country who don't pay as close attention to what government does day in and day out as we do. And they were just coming around to the idea of, oh, yeah, this is serious. I got to do what they're telling me. Let me change my life and go into a lockdown mode. And here the president's coming along and saying, well, we're almost done with this, light at the end of the tunnel, and we want to get back to going to church or religious services by Easter time. It's just totally contradictory and confusing, and raises the specter of, well, how much longer do we really have to do this? I mean, we have all this problem with younger people in particular not paying close enough attention to what you have to do, because not realizing their own vulnerability. And then the president says this. But I was struck by something else that was contradictory yesterday, and I thought was more positive. The president, while he had his Fox News event earlier in the day and was saying that this is what he wanted to have happen, he came out, he was so much more disciplined during that briefing last night. It was clear that his public health folks said to him, you can't commit to this date, that it's got to be based in the data, it's got to be based in the science. And I thought, Dr. Fauci, who was again at that briefing yesterday, made it very clear with his hands alone. If you have cases in New York in particular going like this, you're not going to tone down the restrictions around the country. So I'm just confused about where we go. I can understand the need for certain parts of the country that don't have the level of disease that New York has to try to, in their own isolated way, resume activity. I just don't know how it would work in practice.
Maggie, if we can talk a little bit about another interesting dynamic going on here, which is the president's relationship, or the White House relationship, with the nation's governors. Because the president, during this town hall yesterday, said something that indicated it was almost a warning to governors that they better be nice to him. Listen to this.
It's a two-way street. They have to treat us well also. They can't say, oh, gee, we should get this, we should get that. We're doing a great job, like in New York, where we're building, as I said, 4 hospitals, 4 we're literally building hospitals and medical centers.
They have to treat us well also? What exactly does that mean, and how does the president perceive these actions and statements being made by governors around the country?
John, as you know, as well as anyone, this president internalizes almost anything that is said about the federal government as if it is some personal criticism directed at him, pleas for additional help, or a criticism of him. He is seeing all of this through the lens of how it's covered in the media and whether he is coming off well and getting credit or praise or blame. And there had been a couple of days, I think about a week, where he and Governor Cuomo, who are often at odds, were praising each other. Cuomo clearly realized that praising the president was the best way to get help for his state. But at a certain point, it stopped mattering, because what Cuomo was seeing is that the number of ventilators that he needs vastly exceeds the number that he's getting from the federal government. He made that plea to the president yesterday, and he was not naming the president, but as you saw by what the president just said, he takes it all personally, and he genuinely believes that these relationships all flow up to him, as opposed to what government is supposed to do for the rest of the country. I think that you saw that in his relationship with Gavin Newsom, where Newsom said nice things about him. The president then acted nice in return. Governors who have not been as praising of the president, he has criticized, such as Jay Inslee in Washington, who he called a snake. At least 2 weeks ago. These weeks all blur into each other. And he said he had told Mike Pence to stop being nice to him or dealing with him. This is emblematic of how the president views every relationship he has as president, that it is as much about how anyone treats him as his obligation to the country. And you know what? It has generally worked for him and not really moved opinion polls. Maybe it will continue to work for him here. But I can't remember another time where there has been a president saying, you must treat me nicely if you want to get medical help.
People are dying, and people's lives should not have to depend on flattery.
That's right. That's right.
Maggie Haberman, David Gregory, thank you for being with us this morning.
Thank you.
And John, I mean, ultimately, I was just struck by how ultimately it's going to be up to the governors. The governors in each state are going to decide when their city can get back to normal, and New York City is so far away from it. Meanwhile, Europe, of course, also hit very hard by coronavirus. Germany's death rate, though, is remarkably low. Why is that? That's next.
Now that we have over 100 HD channels to choose from, we're making it easier for you to enjoy them. From April 1st, we're reorganizing our channel numbers by HD and package. So it's simpler for you to look for your favorite HD channels and maybe discover new shows too.
Air, fire, water, earth.
To get the full list of our new channel numbers, go to channel 100 or WhatsApp us.
To help you and your loved ones through this testing time, from now until March 31st, we're opening all our movie channels for all our customers to enjoy complimentary viewing. Stay safe, stay home, and stay entertained with us.
We are going for the Afro-futuristic kind of vibe, all right? So this is like Africa in its originality with some swag to it. So you have dancers, you have vixens, and they all will be on this African set.
These musicians, directors, and performers bring a new energy to the music industry.
Nice. Nkeng is the best here in Cameroon, always bringing you things that you can't even imagine.
You have to get into the studio, you have to do something that shows that this person is from Cameroon. And so they get to put in the pidgin English, the dialects and the French, the Mboko and everything. So it's a whole thing, and we have to keep that because it's a country we can't deny it.
Christiana Manpour in Amsterdam, Jerusalem, Sarajevo, Afghanistan. I'm Christiana Manpour in Iran. Christiana Manpour, CNN, with elements of the Galilee division in Israel.
As dusk fell, people were still marching.
Here we are in Habila, a village that has not had any food distribution since June. When the families have finished looking at the names that are posted on those boards, they come here. This is now a memorial to the victims of the Srebrenica massacre. We're very interested to see what's going on here. Mr. President, it's a privilege to address you from Sarajevo. Do you not think that the constant flip-flops of your administration on the issue of Bosnia sets a very dangerous precedent? This is a pretty shocking picture. Would you condemn President Assad for 100,000 plus deaths? You still have huge dreams. They didn't take that away from you. In a matter of 26 days, legislation was passed. I wonder whether you ever think that other countries can learn from what you did. What made you be so passionate about the environment? I saw you listening to that testimony. You look pretty broken up yourself. Mm-hmm. Does love have a chance still of winning?
I always believe that.
Okay, we do have breaking news. Prince Charles has tested positive for coronavirus. We do now have some more details on his condition. We have a new statement from Buckingham Palace. The statement says that this has been obtained, we should tell you, from our correspondent Max Foster in London. Quote, the Prince of Wales has tested positive for coronavirus. He has been displaying mild symptoms but otherwise remains in good health and has been working from home throughout the last few days as usual. The Duchess of Cornwall, Camilla, has also been tested but does not have the virus. In accordance with government and medical advice, the Prince and Duchess are now self-isolating at home in Scotland. It goes on to say it is not possible to ascertain from whom the Prince caught the virus, owing to the high number of engagements he carried out in his public role during recent weeks. So it sounds as if the palace is telling us that he is still in good health with mild symptoms. He is 71 years old. Obviously, this is concerning anytime anyone catches coronavirus, but particularly for someone at that age. But Buckingham Palace says at the moment he is in self-quarantine and doing well. We will keep you posted. Meanwhile, the number of coronavirus cases around the globe is now more than 425,000, with nearly 19,000 deaths globally. Europe has been hit hard, of course, Italy and Spain in particular. Germany also has a high number of coronavirus cases, almost 33,000, but only 159 people have died. That's a lower rate than other countries are seeing. And the question is why? What are they doing? CNN's Frederick Pleiken is live in Berlin with more. Do we have answers, Fred?
Hi, Allison. Well, we do to a certain extent, and it's really fascinating. The German death rate right now is between sort of 0.4 and 0.5%. And we actually this morning asked the head of Germany's Center for Disease Control why that was the case. And he said, to a certain extent, they actually themselves are quite surprised by it. But they said that essentially it comes down to three things. Beginning testing, mass testing very early, doing a lot of testing for coronavirus, and then also, of course, a very good healthcare system as well. The Germans say they started a massive campaign for testing people for coronavirus in early January already. Right now, they have a capacity, and this is for a population of about 80 million, so about a quarter of the United States, to test about 160,000 people per week, and they say that they can ramp that up considerably if they want to. So essentially what they're saying is they're missing fewer infections. A country like Italy, for instance, says that the actual number of infections that they could have is about 10 times higher than what they have confirmed. The Germans believe that that number for themselves is a lot lower. And of course, if they know which people are infected, they can also isolate those people a lot better. Another really fascinating number, Allison, is that in Germany, younger people apparently are being infected than, for instance, in Italy. In Germany, the average age is about 47. In Italy, it's about 63. So the Germans are saying, on the one hand, they have fewer severe cases than, for instance, Italy, than, for instance, France and Spain as well. But they also have, and this is key, they say, a lot of intensive care unit beds with a lot of ventilators. And they say right now, simply, their healthcare system isn't as overwhelmed as some of the other healthcare systems in Europe. And therefore, their doctors aren't having to make those really difficult and sometimes tragic decisions about who gets to be on the ventilator and who doesn't get to be on the ventilator. And they're preparing for more. They say they want to double the amount of intensive care unit beds that they have. But there's also a word of caution, and I got this directly from the German Center of Disease Control as well. They say, look, we always have to keep in mind we are still at the early stages of this disease. All of this could get worse in Germany as well. Of course, there's also some shortages here. But in the end, right now, they believe that they're doing fairly well in keeping the death toll as low as they possibly can, Allison.
That is great news, Fred. And of course, yes, we will watch them, but maybe they are a model that some of the other countries could follow. Thank you very much. John.
Right. The issue is so far. They're doing well so far. They know that could change. Joining me now is Dr. Ken Sepkowitz. He's a CNN medical analyst, deputy physician-in-chief of quality and safety at Memorial Sloan Kettering here in New York City. And Doctor, thanks so much for being with us. I want to throw a chart up onto the screen so people can see the mortality rates in different countries around the world. We were just talking about Germany there, and you could see that Germany's death rate's at 0.4%, Italy at the highest at 9.5%. Of course, keep in mind that a lot of this has to do with the relative number of tests. There may be far more many cases than we know of. The death rates may be lower, but you can see the difference here. Broadly speaking, what gives a country a lower mortality rate based on what you've seen than a higher mortality rate?